If you look in the blood of patients with stage 3 melanoma, surgically free of disease, there's no visible tumor, half of them at least or more, you would detect circulating tumor cells. They're there. They're just waiting to pounce. The immune system is barely holding them in check, and if something happens to make them just go over the edge, all of a sudden those tumors will grow. And I think most people, if they had a reasonable thing they could do that would cut that risk in half, which is basically the risk reduction with the adjuvant therapies, they would do the adjuvant therapies. Adjuvant therapy is treatment that's added to surgery after the surgeon does his or her thing and they remove the tumor. Clinically, it's gone. But we all know that melanoma, depending on how thick it is and how many different qualities it has, can have a very high risk of relapse even after the surgeon takes it out. In adjuvant melanoma therapy, we tend to give immunotherapy first. And then if you fail the immunotherapy, you develop a new tumor that can be surgically removed to render you free of disease. That's when you give the targeted therapy. There are actually multiple adjuvant therapies approved. There are 2 targeted drugs that are approved for adjuvant therapy, and there are at least 3, and there will be very soon 4 immunologic drugs that are approved as adjuvant therapy. And all of the adjuvant regimens, almost arbitrarily, are given for 12 months. When you think about it, if you're a patient, 12 months of treatment, either every 2 weeks or every 4 weeks or every 3 weeks, whatever the schedule, that's about as much as you want to do. 95% of all the relapses will have occurred by year 5, and at year 5, you feel like you're pretty close to being out of the woods. And you just got to go about your life, not worrying that, oh my God, is the melanoma going to come back at year 8? So I tell patients, go out, glass of champagne, celebrate, you got to year 6, you're free of disease, feel good about that. We're going to stop scanning you.